So the scenario is an elderly woman, usually impaired and wearing dark glasses, lives independently despite having undergone mitral valve replacement surgery and battling colon cancer. He is currently taking warfarin and is scheduled for recurrent hernia surgery. To do yourself and responsible for Miss Anna questions. You have not 8 minutes and 40 seconds. Okay, let me put the timer. You can start.
Hello, Miss Anna.
Hello.
I'm Dr. Fathur Rahman, one of the surgical doctors working here. I'm understanding you are worried to stop your heparin. I'm here to discuss this concern with you. Is that okay with you?
Yes, doctor.
Miss Anna, could you please tell me more about your concern?
Okay, my doctor told me I should not stop taking the warfarin because stopping could be life-threatening. So they asked me to stop it before surgery.
I completely understand your concern and totally 100% agreed with your doctor. But let me explain how warfarin is working. Okay, warfarin is a blood thinner. Is working to thin your blood and protect against clot formation, which is that important to protect your heart. Okay.
Continue, please. Ala, you can answer.
Okay.
Okay. But we need to stop this warfarin because it has long action, which is stays for 5 days on your blood, and this is interfere with your surgery and give you a risk of excessive bleeding during surgery. Instead of that, we'll continue on injectable shorter acting blood thinner called heparin, which is stay in your blood only for 12 hours, and that allow us to stop it right now, right before surgery for short time.
So why I can't just continue taking warfarin instead of switching to heparin?
Brilliant question, Miss Anna. As I said, the warfarin stay in blood for more than 5 days, and which it interfere with your surgery and put you in the risk of excessive bleeding during the surgery. And heparin is shorter acting, and we can stop it just 12 hours before surgery and reduce the risk of bleeding.
Okay, can I start taking when can I start taking warfarin again?
After surgery, when we ensure that you are not in a risk of bleeding and you are allowed to take orally, we can resume the warfarin. At the same time, continue the heparin, and we continue to monitoring you by blood test to ensure that warfarin start working properly. Then we'll stop the heparin and continue on warfarin as before.
Okay, do I need to stay in the hospital before the operation?
There is a lot of options for that. If you can inject yourself at home and continue monitoring to visit the coagulation clinic, you can do that. Or we can allow the social worker to provide a nurse to give you the injection once a day and continue monitoring and visiting the coagulation clinic. Or if not that able, you should stay at the hospital for 5 days for the monitoring and close monitoring your regular blood work.
Okay, but what about my anxiety medication? Should I stop it like warfarin?
No worries. You can take your anxiety medications till the day in the morning of the surgery, but you need to take with sip of water only.
Okay, thanks God. I really need these pills.
Yes, I am understanding. Thank you, Miss Anna. Do you have any question or concern?
No, thank you.
Okay, Miss Anna, let us summarize our discussion. You will stop your warfarin. Instead of that, you will be given heparin till the surgery is performed. Then will you resume your warfarin and stop the heparin. Thank you, Miss Anna, for your cooperation, and we are here to support you throughout the process. Please, if you have any concern or question, don't hesitate to reach out.
Okay, thank you.
Thank you, Miss Anna.
You have 3 minutes and 30 seconds.
I think I have done nothing more.
Yeah.
Do you want to ask any question?
No.
Can you start, please?
What, Mohammed?
Okay, you can start.
Okay, good, Fatah Rahman. So the only difference that you will find through your examiner, your patient will just be a bit more challenging.
Yes.
When you tell him stop your GB. Ala did a good job, but your patient on the exam will be a bit challenging. He will say, no, I don't want this.
Yes.
And then you're just going to try to convince him again. All right? You have small mistakes. You said, I understand you are wet. I understand you are waiting, or it's not you are waiting. In the medication, you said it have. When you spoke about the drug, you should say it has instead of it has. It has such and such. And also you said, I understanding. You can say I understand, or I totally understand, or I see. It's not I understanding. You will be surprised by the mistake that you do. If you review the record, I'm sure you're thinking, I didn't say I understanding. I wouldn't say that, but you said it. You said I understanding.
Yes.
You answered most of all her question. I don't think did Ala forgot any question, Mohammed? Did Ala forget any question?
No.
I think no.
Yeah, I don't have more point than this.
Yeah, very nice job, Ar-Rahman. I think I have 1 point or 2. You when Allah asked you about something, you said, as I said to you. It's been unprofessional if you say to your patient, as I said, because as you don't need to repeat your information. You can just repeat it without as I said. And the last point, you summarize your discussion and you didn't ask your patient to summarize. It's better to make sure that the patient understand your information. So it's better to let the patient or simulator summarize to you. Then you can summarize if you need. Okay.
I should ask her first to summarize. Then
Yes,
I summarize.
yes. To know that she understands all the information you provided to her.
Yes, because I followed just our school. It is not.
Yeah. I'm really sorry. I will update this.
Yes, please.
Yeah. Okay. Otherwise, you did very good.
Wait, Mohammed. Mr. Khalid summarized what we discussed. Okay, so you can just ask for a quick summarization from the patient. That should be fine.
Yes.
Then you're just gonna repeat exactly what the patient said. And you thanked your patient at the end, right?
Yes.
Yeah. Okay. Good.
Perfect.
Thank you.
Okay. Should we go to the next station? The next station. Okay. The classroom.
Yeah, Fatah Rahman, I want to say a really important point, especially because you have 3 minutes extra. You should find something to do. All right. So you can ask your patient to summarize for you, and you can summarize to the patient, especially when you have a lot of time, like this situation. You had 3 minutes.
Yes, but in the exam, the patient will struggle me with a lot of interference sentence. I think it will not be a 3 minutes.
Yeah, in the exam, the patient will say, no, I don't want to take it. I don't want to stop it. Why are you asking me to stop it and this stuff?
Yes, I know that.
But you should just prepare yourself to convince him or convince her. Okay?
Sure.
What is the next station, Mohammed?
Yeah, anxious mother splenectomy. Who will take this station?
Ahmed already.
Yes.
Ahmed, patient.
Ahmed is the doctor and the patient, yes.
Ahmed, patient Ali, you right. Ahmed, patient Ali. What's Ahmed, patient Ali? Dr. Ahmed, patient Ali.
Yes.
Yeah, Ahmed, are
Okay.
you here? Okay, fine.
Yeah.
So the scenario
This.
is, you will be the patient Ali.
Yes, someone need to mute himself. I don't know why this background coming from. Is it you, Ahmed?
What?
Muhammad?
No, it's not me. It's Ala, I think. No, Ala. It's Ahmed. Or
Mute?
you are.
I'm not mute.
No. You should unmute yourself.
Some of noisiness.
Unmute or mute.
No, okay. Let's start now.
Some noise around me, I think.
Yeah,
That's fine.
no problem. So the scenario, Ahmed.
Okay.
Sarah.
Can you open the camera, Mr. Ali?
Of course. I didn't know it's closed. Okay,
Yeah.
let's start.
Scenario. Sarah, a woman, arrived at the hospital after learning that her child had been brought in by her husband, X. She immediately became anxious, raising her voice in distress and demanding answers. Your task: explain to Sarah what happened, reassure her, answer all her questions. You have 8 minutes and 40 seconds. Let me put the timer. You can start.
Hello, Miss Sarah. I am Dr. Ahmed Al-Sougi, one of surgical doctor working here. I am going to provide you some about the point of your child. Before we start, can you tell me what do you know about your child so far?
You seriously starting to ask me question? I wouldn't
Okay.
buy it, doctor. I'm the
Okay.
one who's supposed to ask questions.
Okay. Oh, I am sorry for that, Miss Sarah. Can you please take a seat?
No, I
take
don't
our conversation?
I don't want to sit. I don't want to
Oh,
sit.
I apologize you to sit. Okay. Is that okay, Miss Sarah? Please sit for me, and we
Yeah,
can
but
take our conversation.
you better do your job, doctor. I
Okay.
just said now, so please
Oh,
don't ask me questions. I'm the one who has
oh,
a lot of questions I need to ask.
oh, I am sorry. I am sorry for that, Miss Sarah. You your child was fell down while he's climbing a tree,
Okay.
and we did the tummy scan. Do you
Okay.
know that?
No, I didn't. How can I know, doctor? How can I know?
Yeah.
Yeah, and who brought him to the hospital?
Oh, your husband brought him to the
He's
hospital
not
and
my
says that.
husband, doctor. He's my ex-husband. Don't say husband.
As he said to us, he is your husband,
I
and
don't care what he said to you, doctor. I don't care what
okay.
he said to you. He's not my husband. I'm telling you now, he's not my husband.
I am really sorry. I'm really sorry for that, Miss Sarah. Okay, can I explain to you what happened to your child now?
Yes, please. And be
Okay.
quick.
Okay. Our scan showed us that your child has what we call splenic rupture, and spleen is an important structure that located right there in our tummy. Okay, and I can draw it for you to be clear. Okay,
Yeah,
Miss
draw
Sarah?
it, but be quick, doctor, please. Why are you
Okay.
taking like
Okay.
ages?
This is our body, and this is our tummy. Okay, in the left side here, right there, is spleen located here. Okay, and it's important structure in our
Okay.
tummy. Okay, Miss Sarah.
Yeah, so what happened after that? You said your scan showed a rupture.
Oh, and I apologize to you, Miss Sarah. We took your child to theater before informing you with this important information, because his condition was so serious, and so we took him to the urgently to the theater without informing you. Okay.
Yeah, and I'm not happy about that, doctor. I'm not happy about that. You call my ex-husband, and I'm not sure exactly what happened, and you just took him to the theater. Is it a serious condition?
Unfortunately, yes, it is a serious condition, and and for that we took him urgently to the theater, and still his life is threatened by this condition.
Wow, man. You
And
don't know. You don't
and
know how to. You don't know how to speak, doctor. You're so rude. You're so tough.
I am sorry for that, Miss Sarah. But the good things I want to inform you about is only good, skilled, and meticulous surgeon operate upon your child now.
How did he get the injury?
While he was climbing stairs, he fall down and
And who told you
seriously
that?
injured
Who told you that?
your ex-husband, as you said, Miss
But
Sarah.
he's abusive, drunk piece of shit.
Oh, I am sorry for that, Miss Sarah. I'm sorry for that. I'm sorry. I'm really sorry.
So how can okay? You stop being sorry, doctor. You said I'm being sorry and sorry, but I don't think you are sincere in your sorriness. So how you gonna protect my son then?
Okay, in that we can do extra precautions, and we will inform our child protection consultant, and to make sure that your child best interest are safeguarded. Okay.
Okay, will my son require any medication, doctor, after this operation?
Course, if this spleen if we resect the spleen, we will need we will need to take vaccination against infection, and we will need to take and we'll need to take antibiotic for 1 to 3 years at
How long?
least.
Oh, I did understand that. Even though that's a very sad news. How long will the
Mm.
operation last, doctor?
I cannot determine how long the operation lasts, Miss Sarah, but when it lasts, I will tell you about that. Okay.
Oh, when can I
Mm.
see him then?
After he came out from the operation, I will tell you as soon as possible to see him.
But will he come tomorrow then? Give me just an estimation, doctor.
No, I cannot estimate the exact time of this operation because it's an emergency operation, and it will take time, and we cannot determine it properly. Okay, you
Oh,
can wait. You can wait him, and I will provide you with any update.
okay. When can I take him home then?
Okay. Now our priority is to take a medical care of your child. After that, uh, we will talk about his discharge. Okay.
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 I'm
Okay,
not
Mr.
happy. I'm not happy with you, doctor. I'm not gonna be straight, but it is what it is. There's nothing I can do.
Unfortunately, nothing we ca you cannot do anything for that, and I cannot ever do anything, but now your child is operating upon him by most skilled surgeon. I promise you, he is a good hand.
Okay, fine.
Okay, Ms. Sarah. Okay, Ms. Sarah, let us summarize what we told about, and to make sure that all my point go to you. Okay. Your child was brought to the hospital by his ex by your ex by your ex-husband, and we do CTs, and we do abdomen tummy scan that showed us he has a ruptured spleen, and now we operating upon him, and if this spleen removed out, he will take vaccination and antibiotic for this condition. Um, and if you want to ask anything else about your child condition, don't hesitate. I am here for you, and we all here to support you. Is that okay with you, Miss Sarah?
Yeah, that's fine.
Can you tell me the exact point what we?
Yeah, you just mentioned that his dad brought him, and I'm very suspicious about that. You promised me that you're gonna contact the child service consultant. He had a rupture. Yes. Okay. He had rupture spleen and then. Okay. Cool. Ahmed, very difficult station, and during your exam, your patient will be more anxious than me. Even though during the exam, I was thinking, does this lady has a problem with me?
You attack them, you attack them, you attack him. Continue.
So, screaming, even saying the F word, saying the shit word, saying whatever you think about.
Okay.
And I'm glad when I stood up, you stood up, and then you convinced me to stay down. Sometimes your patient will not sit down, so you should stay up with your patient.
Okay.
So the general rule is your level should be the same with your patient. If you convince your patient to sit, you sit. If he said, I'm not going to sit, and he stood up, you stood up for the whole conversation. But do your best to convince your patient to sit. That's the very thing. There's a small mistakes, and there's a golden rule I will give to you, Ahmed. For Ahmed and for everyone, I want you to memorize what we wrote in the school. Okay. Especially in the summary. I don't want you to understand it and then you come and you say it in your own words. I want you to memorize it word by word. Okay? Because you did a lot of grammatical mistakes. Because you understood what you're talking about, but you just didn't pronounce it in the right way.
Yes.
Right? For example, you said all my points go to you. All my points go to you. That's not a sentence. I will just make sure all my points are clear to you, not go to you. Okay? You said we decide on the scan or something like that. So there's some grammatical mistake. I wrote some of them. But long story short, I want, for example, when I said summarize, you should say, let me summarize our discussion. Literally like what we wrote in the school. Look how it's summarized. Your child, as per his father count, fell from a tree and has a ruptured spleen. He's currently undergoing surgery by experienced hand. And you will be able to see him as soon as he leaves the operation room. We are here to support you, and if you have any question, please don't hesitate to contact me, just like this. For example, when I ask you, will my son require any medication after the operation, you should say, if his spleen is removed, he will need vaccination to protect against potential infection and may require lifelong protective antibiotic, but at minimum 1 to 3 years. You should memorize this one. If you revise how you said it right. But you took a lot of time. You said some mistakes. So if you memorized it, then you're gonna just say it like this.
Okay.
There's 40 marks in the knowledge. You should not miss a single one of them. All of them you have 2 communication skills. That's 40 marks. 40 marks in just communication skills. So you should get all of it completely right. So we wrote it in the school in a just summarized way. We did our best. There's no new question will be. It's the same question. It's the same answer. So you should memorize them. Okay. And we made a video too. You can listen to the video for 10 times. Okay? So if you're going to the bus or doing something, or you are tired of studying, just open the video. You are opening the videos, right?
Yes.
That's good. And just listen. And I want you to record yourself.
Okay.
As a doctor and as a patient. Record all the station from A to Z. And then listen to your recording. What did you say right? What did you say wrong? Okay? But you're going to pass this station, obviously. You did pass the station. You said everything right. I'm glad your exam is outside UK, but your examiner may be a British with a fluent accent. In this case, you should be like on top of your grammar, on top of your pronunciation. There's one word, determine. It's not determine. All of us say determine, which is wrong. It's determine. Determine. Okay, good. Muhammad?
Yeah, very nice presentation, Ahmed. I think this is citation because this is your first station and Ali attack you totally. So when you explain to your patient he has a rupture spleen, spleen is an important organ found here in the upper left tummy. You should say this is important because it provides us with immune system or enhance our immune system. Okay.
Okay.
Muhammad, I can't hear you. Muhammad.
You have a problem, I think, Ali. Ahmed heard me.
Yes.
Yeah.
Yes, I
And
hear you.
I am so glad that you mentioned the good things that this patient on unskilled and professional surgeon. When you said vaccination, maybe your patient didn't know what you mean by
I don't know.
vaccination.
So
So you
cool.
should explain this for this word vaccination. Okay. Some
Okay.
material will inject to the patient
Camila,
to
leave me,
enhance
no?
the immune system. And when Ali asks
Okay.
you any question, don't jump to the answer. Just show empathy. I'm really sorry. Then go to your answer. And the last
Okay.
point, before to summarize to your patient, because time didn't allow you to complete your session. So ask Ali to summarize first to make sure that your patient understand every information you say to him. Okay. Otherwise, you have no point. Very nice.
Thank you.
Should we go to the next station? So the last station, classroom, الفاتح. الفاتح is the doctor in this station, the last station.
Yeah.
Yeah,
Who's the patient?
الفاتح. Can you attack الفاتح, Ali, please?
Engulf.
Okay, the last station is
CT scan.
Hassan is not here, unfortunately, so that's all right. Let's start. For whatever reason, if my phone stopped, just continue, okay?
Okay.
Let's do the last one.
Scenario. You have been asked to speak with Miss Mati, who asked to speak to your consultant, Mr. Baker. Mr. Mati, her husband was admitted a few days ago due to abdominal swelling and was scheduled for a CT scan to further investigate his condition. However, technical difficulties with the hospital's CT machine have caused delays in obtaining the necessary diagnostic images. Miss Mati is understandable, concerned, and frustrated, and you need to address her worries and provide her with information and support. You have 8 minutes and 40 seconds. You can start.
Hello, Mrs. Matt. I'm Dr. Ali, one of the surgical doctors here today. I apologize for being waiting too much to see Mr. Baker.
You are not Mr. Baker, doctor, right?
Yeah, I'm not Mr. Baker. I'm here instead of Mr. Baker because Mr. Baker has been called for emergency operation. So I'm here to discuss with you.
Look, doctor. Let's put things straight.
Yeah.
So I have an appointment with him, right? He should keep his promises.
Yeah, I appreciate your concern, but this is a different situation because he has been called for emergency situation. He is saving a different life. But I'm here to discuss with you your concern and to see what I can do for you.
But I want to see Mr. Baker, doctor, with all due respect.
No worry, Miss Matt. I will arrange you a point to see Mr. Baker, and definitely I will tell him you were here, and he can as I say, I can promise you appointment to see him.
Okay, so if you can arrange an appointment to see him, I just want to make sure you are the right doctor. So do you know what's going on, or should I explain from the scratch?
Yeah, I will explain to you what is happened, and I'm happy to discuss with you your concern. Is that okay?
Yeah.
So your husband has been brought here in a couple of days because of abdominal swelling, tummy swelling for last 6 weeks. 6 weeks.
Okay.
Because of fluid collection in his tummy. We take a sample from this fluid, but the investigation show cancer cell. We need to do a CT scan to show where is the origin of these cells and where is it, how much is spread, and to where it is
That's fine.
extent.
That's fine. That's fine. Why the why is the CT scan is required, doctor?
Because we don't know where is the origin of this cell. We need to do CT scan to see where is the stage of where is the origin of this cell and where is the extent and the type of this cell.
Or is it a cancer then?
I appreciate your concern, but to say for any patient or his relatives this is a cancer, we need to do many things like many investigation. But we only have just acidic analysis which contain malignant cell. We don't know what is this, what is the type of cell, what is the type, where is the origin of
So,
cancer.
doctor, let's be clear. I think that's just a diplomatic answer. Is it a
No, no.
cancer?
As I said, I can't say it is a cancer because we don't have a confirmation.
Yeah, but you said there's cancer cells, right?
It is cancer cell, yes, it is cancer cell, but we need to proceed on to do a different investigation.
To be honest, I'm not surprised. That's what doctor do. You never say for sure. You always hesitant. Okay, does he need a surgery?
Okay. Yeah, to do a surgery for cancer patient is depend on what is this surgery is helpful or improving his condition or not. In your husband condition, the malignant cell in his fluid means that he is at in advanced stage. So we need to do a CT scan, but we experiencing technical issue with the CT scan machine. So we will do another option.
So you are not doing a surgery then?
It depends on the CT result. Does that make sense?
Okay.
Okay.
So his brother is, it doesn't make sense, but I will just roll with you. His brother is not here right now. He's traveling. Should I just tell him now?
I appreciate the family support, but I think I recommend to wait until we have all result, and then you can tell them. Just let wait to complete our investigation.
Okay, I think that now you are making some sense. Yeah.
Yeah.
Is there an alternative for this CT?
At this time, we can the radiologist suggest to do ultrasound scan. It is it is like a jelly scan for pregnant lady. You know that.
Okay.
This can give us clue about the liver and about the amount of fluid there. And also, we can do MRI. It is equally like a CT scan, but we need a permission from Mr. Beaker to do that. Otherwise, we can transfer him to another hospital to do a CT scan.
Yeah. Now, yeah. Okay. I appreciate your time, doctor, but
No worry.
there's one thing that doesn't make sense to me.
Yeah.
If you already know your CT scan is broken, why did you transfer my husband here
I
instead of just
totally, I totally agree with you, but we are a small hospital. We don't have much resource to do that, but still we can do all investigation within 2 weeks, which is time frame for like this for these conditions like your husband.
You still did, yeah, it's just a diplomatic answer. You still didn't answer the question. Why didn't you just transfer him directly to that hospital?
Just we need permission. If we don't mind to transfer him, it if we see that it is mandatory to refer him to the other hospital, we can do because we have a
Okay,
lot of
okay.
time.
Yeah, okay, fine. And
Okay.
he's struggling to breathe right now, doctor.
Thank you for this question. Your husband have fluid collection in his tummy, and this make pushing on his lungs. That is why he has difficulty in breathing. But we can uh, we can improve this condition by withdraw some fluid from his fluid collection, and also we can give him medication to decrease the amount of fluid. Does that make sense?
Yeah,
Okay.
that's all right.
Okay.
I do understand. Last question, doctor. I believe he developed cancer because of his work environment or whatever. So I want to file a complaint against my employer.
This is not our specialty, but I agree with you. But I can guide you to the legal team. Definitely, they will guide you to do in a specific way, and you can go with them to discuss this issue. I can guide
Okay.
you.
Yeah, that's fine.
Still, thank you very much. And if you have any concern, please let me know.
Yeah, that's all right.
Mrs. Matt, can you summarize what we have gone through?
Yes, you said the CT scan is broken or whatever. You have some alternatives
Mm-hmm.
which you are not sure about. You can transfer him if the CT is not working and you need it.
Mm-hmm.
You're still not sure about the diagnosis.
Mm-hmm.
And you will take some fluid
Time up.
from
Time
his
up.
abdomen to make him breathe better. Okay, cool. Good, Al-Fatih. Mia. That's a pass for this station. But there's some points I need to mention quickly.
Mm-hmm.
I think the most important one is when I ask you, is it a cancer? I know, look, everyone, there's some resources outside. I don't want you to follow anything beside the school because some answers in these resources doesn't make sense.
Yes.
Especially in the communication. Okay?
Okay.
So when they ask you, is it a cancer? It is a cancer, Fatih. But we don't know, is it a liver cancer? Is it a renal cancer? We don't know exactly what's going on. So your answer, you answer 50% of the question right and 50% of the question wrong. When she said, is it a cancer? Especially after she tried to convince you, she say yes, but we need more information to confirm the diagnosis and identify the origin of the cancer. Because you have cancerous cells already in the acid fluid.
Yeah.
So it's a cancer, but you don't know what cancer, where, which stage. Is it the stomach cancer? Is it the bladder cancer? We don't know.
Yeah, Ali, and I wanted to say yes, it is cancer, but we have not enough information. فأنا قلت يمكن كده تتدخل معي في الإجابة تعملها hesitation.
No.
كيف أنا أقول لها هي كانسر ولسه ما عندي enough information. خفت من
But,
الحتة دي.
but if she asks you what's the type of the cancer, then your answer will be right. But she said, is it a cancer? It is a cancer.
Yeah.
But we don't know exactly what's the type of the cancer. Secondly, when she asks you for a surgery for this man who is 79 with this advantage level of cancer, usually it will be non-operable. Okay? So you should say exactly, surgery is considered for cancer where there is a potential for improvement. However, in Mr. Matt's case, the advanced nature of his abdominal swelling suggests an aggressive cancer. In such cases, surgery may not provide significant benefit and may only increase discomfort.
Okay.
So, both from practical point of view, usually if someone has ascites as a complication of hepatocellular carcinoma or whatever, and is completely metastasized to his body, then there's no point of you operating.
No operation, yeah.
Yes, so you should. That's why for Al-Fatih and for everyone, I know you understand the point, all of you, but I want you to memorize what's written.
Okay, we'll do.
So I want you to memorize the answer, like literally say exactly the way we say it in school. Okay?
Okay.
For when I ask you about the solution for the breathlessness due to ascites, you answered it right, but you can just add, and I need to discuss this with Mr. Baker first. because your level here is
yes.
your
Okay.
level your level here is an SHO. You are not a consultant. So I will discuss this with my consultant, but one of the solution is this and that.
Yes.
Right. You said this small grammatical mistake. Instead of we you said we take, but you should say we took. The investigation showed.
We took fluid, right?
Yes.
Yeah.
The investigation showed, not show. Yes, I think, but overall, that's a pass for this station. It's just these small points here and there, and I want you to memorize what's written in the school.
والله ما داري نلبس يا اخي بس شويه كده ما ننفع.
Yes, okay. Then memorize. I know you understood everything, but I wanted to memorize the words.
اوكي. لا بس البوينت دي فعلا خلاص يعني الظل لما نسمعها من شخص ثاني بتكون
And I want this. Yes, and I want everyone to, we upload the videos to school, so for one reason, we want you to watch it and review yourself.
Okay.
And see I can improve in this and in that. Okay, Muhammad.
Okay, Fatih, very nice presentation. Excellent. I think Ali covered all the points, just 1 or 2 points. As I said previously, don't hurry to answer before reassuring your patient. You said, I think Ali asked you a question. You said, as I said. You should say first, I really understand. Then just repeat your information. Don't say, as I said.
Yeah.
Okay. And Ali, what do you think about saying, I promised to arrange with a consultant? You said, I promised. Is it easy to say? You should not say, I promise. You should say, I will arrange an appointment with my consultant.
Yeah.
Yes.
Promise is not acceptable. Yeah.
Yeah. And the last point, when Ali said to you, it's not clear, and I will rule with you. You just silent. You should ask your patient, can I explain to you what the thing is not clear? Don't silent and let the patient not understand, okay?
Yeah.
Perfect. Otherwise, I have no point.
Thank you.
So I think we finished from today. The next station.
Tomorrow.
No. I think
I want to ask question, Mr. Muhammad.
Okay. Tuesday, yeah.
Just